Okay. Good morning, everyone. This is our awesome group here. I'm just going to go around. I'm going to introduce myself. I'm Francis, Duenas, a PA student, and you guys can just introduce yourself.
Hi
Hi,
there.
I'm Claire.
Oh,
Oh,
go
sorry.
ahead.
Hi, I'm Clarabelle. I'm a student nurse. I'm a nurse in MSN.
Hi, I'm Farah Khan, and I am a registered nurse in the Med Surg Tele department, and I am now in the FNP program here at Cal Baptist.
My name is
I
Caitlin
am Raphael
Hownitz.
Ali. Oh, sorry.
Go
Go
ahead,
ahead.
Raphael.
Go
You're
ahead.
good.
Okay, my name is Raphael Ali. I'm a registered nurse at Patton State Hospital, and I'm studying to be a psychiatric nurse practitioner.
My name is Caitlin Hownitz. I'm also a registered nurse, and I'm in the MSN program for acute gerontology and acute care NP.
I'll go next. Hi, I'm Jessica Moreno. I am an athletic training student, currently studying to be an athletic trainer.
Cool. Yeah.
Hi, I'm Makai and I'm in the athletic training program.
Okay, awesome, you guys. Thanks for doing that. Really good to meet you guys. So I'm just going to start off by reading the prompt and then we can do our thing. Okay, so the prompt is this past month, the Coachella Valley Music and Arts Festival in Coachella, California became the epicenter of a TB outbreak, tuberculosis. The festival, which attracts hundreds of thousands of attendees from all around the world, provided an environment, conducive to the spread of tuberculosis due to close contact among attendees. The TB outbreak at Coachella Music Festival was identified through a combination of clinical observations and public health surveillance over the last month. Initially, local healthcare providers noticed an unusual increase in patients presenting with symptoms consistent with TB within 4 to 6 weeks after the event, such as persistent cough, fever, night sweats, and weight loss. The TB outbreak at the Coachella Music Festival highlighted the importance of a coordinated response involving multiple professions: public health officials, social workers, and athletic trainers, nurses, physician assistants all played vital roles in the managing of the outbreak and supporting affected individuals. This case study underscores the need for preparedness and collaboration in responding to the infectious disease outbreaks in large public events. So we're just going to go around. We're starting with the public health perspective. I think that's maybe Mr. Raphael, we want to kick us off there. The public health perspective. What strategies should public health officials employ to prevent future outbreaks at large events such as the Coachella Music Festival?
Yeah, in my opinion, I think what they should do is first of all have a brief survey of the Coachella Valley area and work in collaboration with the local public health officials there to come up with a plan for such big events as we have in the Coachella every year. And then work with the local health officials as well to create a strategy for making sure modalities are in place to control crowd, look at the history of epidemics in the area, what has been done before, what are the likely causes of incidents of this nature, and what could be done to prevent it. I think for a big event like that, there should be like a huge presence of public health officials, nurses, doctors, volunteers from different angles who should just come in and be there and educate people on what they should do in terms of hand washing, in terms of universal precautions. Little issues like that that prevent spread of disease in a big event like that would be very important. Um, yeah, it's pretty
Awesome.
much what I can come up with right now.
No,
Yeah.
that's great. Thank you.
Sure.
I think we'll move on then to the interdisciplinary collaboration. Maybe Miss Farai.
Okay, yes, perfect. So let's go ahead and start here with so it says, how can healthcare workers address the stigma associated with TB in the affected community? So pretty much healthcare workers can reduce TB-related stigma by providing consistent, culturally sensitive education that emphasizes that emphasizes TB is treatable and that it's not a result or personal fault, most importantly, and protecting the patient's confidentiality using respective language and coordinating clear messages across disciplines. This will help build trust and encourages early testing and treatment.
Awesome.
And then we'll go ahead and cover what ethical dilemmas might healthcare workers face when advocating for patients' needs versus public health priorities. So healthcare workers may face ethical dilemmas when patients' autonomy and confidentiality conflicts with public health requirements, such as reporting, isolation, or contact tracing. So providers must balance protecting individual rights when ensuring community safety while acting in the best interest for both the patient and the overall population. And lastly, we have the athletic trainer perspective. So the question, this doesn't fall under the nursing profession, but we will cover it. How can athletic trainers contribute to early detection and prevention for infectious disease at large events? So basically, athletic trainers can contribute by recognizing early symptoms of infectious disease, encouraging prompt medical evaluation, and communicating concerns to the interprofessional team based off their evaluation. They can also support prevention by reinforcing hygiene practices, monitoring for close contacts environment during these large events.
Great. Jessica, you want to expand on that a little as well?
Yes, so athletic trainers can also document the number of cases that come into the clinic. So usually we work with sports or in the industrial settings, so we could start gathering statistics to provide to the public health. Also aiding and helping out monitoring symptoms, trying to assess what's arising the most. Also advising and guiding the patient with the instructions provided by their physicians, how to quarantine, what medications to use and everything, and any other questions that they may have in mind. Also asking the patients how they're handling with the weight loss, and then also seeing if they have that symptom. Performing on-site evals, performing a symptom history in the past 3 days if they have any, and then also asking who are they around, and then also to be able to contact them and to notify them as well. And then just the importance of hygiene PPE, which is protective equipment and distancing.
Thank you. Now for our team nurses.
Okay, so nursing perspective, what ethical challenges do nurses face when providing care to TB patients in resource-limited settings? Anna isn't in the meeting, but she did contribute to the document, so I'll read her response first. Anna Howard said, some ethical challenges I could identify are that nurses struggle to keep patient information private while still reporting TB cases and helping with contact tracing to protect the public, which can make patients feel their trust is being broken. TB also has a lot of stigma around it, so nurses have to make sure they treat patients with respect and kindness, even when others are scared, or judgmental nurses may also feel pressured to convince patients to accept treatment, even when the patient doesn't fully understand it or agree, which can compromise patient rights and consent. All of these issues make caring for TB patients very stressful and emotionally exhausting for nurses, especially in places with limited resources. Just to add on to that, my input is some other ethical challenges that they can be faced is in resource limited settings, there may not be able to be comprehensive or adequate care provided to patients just because of such a large number of people and population are being affected. There can also be issues in properly prioritizing and triaging patients to ensure that patients are receiving the necessary care in a timely, organized manner because it can get pretty hectic with such a large group, just to make sure we promote the best possible outcomes.
Okay. I guess I'll first of all, can everybody hear me?
Yes.
Okay, I'm like I had my mic on mute for a little bit. But yeah, I don't think I got to introduce myself. My name is Sophia. I'm a registered nurse and I'm in my master's program for a nurse educator. But some of the risks or ethical issues that I kind of put in the document is exposure risks for nurses. The treatment for TB patients is a long-term treatment. Sometimes it's uncomfortable for patients as well. So I also put in there that patients sometimes refuse or don't continue treatment. So some ethical stuff, I think I heard it addressed also in the public health response, but it's pretty much, there's responsibility that as a healthcare workers, we have to, respect patient autonomy or their right to refuse care, while also trying to maintain, our responsibility for the public health. So those were the ethical dilemmas that I put it on mine. Yeah, so I put exposure risk, patient privacy. Yeah, also with patient privacy, sometimes with um, reporting exposures as well, needing to get the patient information, and not that we're releasing it to the public, but it is public's health responsibility to get all that information related to, what patients were exposed, or who was the initial person that was the one that exposed others. Yeah, that's what I came up with my response.
Awesome, thank you. So the next prompt, physician assistant perspective. The prompt is what diagnostic and treatment protocols should physician assistants follow for TB patients? So essentially, as a physician assistant or all the clinicians that are involved, patients should be promptly evaluated, of course, beginning with a history taking, symptom assessment, physical exam, and then generally a screening tool that would be used would be like a interferon gamma release assay or like the PPD test that we all get. Um, and that doesn't necessarily indicate uh, infection. It can also be positive when they have immunity to TB, or excuse me, they had a previous exposure. But in any case, those are some screening tools. Those with the positive findings should then be followed with like a chest X-ray. If the X-ray is, shows any suspicion of TB infection, following up with things like sputum culture, we can also do an assay to track infectious um, uh, in, if they're infectious or not. And then, of course, if they are, then airborne isolation um, would be a tool that we can use to ensure that it doesn't, of course, propagate. Under the California Code of Title 17, TB, as some of you guys pointed, is a mandated reported infectious disease. So it must be reported within 24 hours if they test positive, as all of our professions are mandated reporters for this infectious disease as others. And then that's, of course, to maximize the safety of the public health. Let's see. So some standard treatment protocols. Many of you guys are probably familiar. It's the acronym RIPE, as Ms. Sophia pointed out earlier. It's a minimum of 6 months, and the treatment is essentially for pharmacological interventions, rifampin, isoniazid, uh, pyrazinamide, and ethambutol. Latent TB is also managed pharmacologically, although it's not infectious, and the timeline of treatment is going to be different. And so pharmacological adherence is a big sort of obstacle when it comes to treatment because of the long course of treatment, as some of you guys pointed out. So there's this thing called DOT, direct observation therapy, which is essentially a program that ensures patients adhere to their medication daily. Um, Otherwise, the efficacy of the treatment is compromised. And so that's essentially part of the standard of care. Of course, there's always going to be drug side effects so tracking that is important. Um, and then collaboration, of course, with the rest of the healthcare team to ensure that we maximize public safety and patient safety. So yeah, that's a little bit of my perspective. And I think we can finish off here with our faith integration.
We also have social services to cover.
Okay. Sorry, I think we skipped over that.
Yeah.
Okay, let's do that.
Okay, we'll do social workers. So social workers perspective, what role should social workers play in ensuring equitable access to healthcare and support services for TB patients. Social workers help patients transition between treatment and real life. Every patient faces unique barriers that social workers try to break down. Social workers are familiar with numerous resources such as financial assistance, food programs, clinics, free TB programs, and housing support. So, for in the Coachella Valley, we would contact the social workers in that area, and if they're bombarded with a lot of the resources, then we could ask neighboring social workers to see what resources they have. With TB, patients need to stay isolated, as you guys mentioned. So it's hard for them to go to work and get resources that they need. So social workers have access to those resources. And they can also help with disability benefits and workplace accommodations, as well as coordinate care and follow-up appointments.
Thank you.
Yep.
Okay, and then down to the faith integration. How can the principles of compassion, justice, and community support guide the response of various health professions to an infectious disease outbreak, ensuring that all affected individuals receive equitable care and support? So we can do this by providing patient-centered care that demonstrates strong bedside manner. So, just having that connection with your patient and understanding like this may be challenging for them. So taking that into consideration, not just looking at them as like the infection or disease that they're dealing with, but, outside of that, any life challenges that this may bring, emotional things like that. And then when it comes to compassion, just helps to ensure that we deliver care to the patient with empathy and respect. And then just like I said earlier, addressing both physical and emotional needs. And then for justice, and it's important to provide equitable access to resources, treatment, and prevention efforts to all patients. So just trying to find ways that we as healthcare providers can help our patient if there are any challenges for that. And then just taking into consideration other populations that might be more at risk for disease and stuff like that. And then just community support. So always encouraging and collaborating among healthcare providers and teams to create a strong like delivery of care to patients and stuff. And then also like partnering with local organizations to strengthen like outreach and trust. And then, yeah.
Awesome. Thank you. That was great, you guys. I appreciate it. I'm not sure who we have Samsung, if you want to introduce yourself.
Jamie's here.
Sorry, you're on mute, my friend.
All right. My name is Jamie.
Oh, okay, great.
Yeah, nursing. Sorry.
No, it's all good. It sounds like your responses were read off by
Oh, okay.
others in our group. So we appreciate you contributing. Yeah, it looks like our time is going to expire soon, you guys. I hate for this to cut off, but thank you again for accommodating this meeting so we can complete this assignment.
Thank
Thank
you for setting it up, by the way.
Yeah.
Yeah,
Thank
of course.
you
It was a
very
team
much.
effort,
Thank
so
you.
thank you guys. I appreciate it. I hope you guys enjoy the rest of your weekend. If you're at work, try not to work too hard.
you.
Okay,
We'll try not to
I'll
then.
send this all in and I'll drop it in our chat, okay? If you guys
Okay.
also
Appreciate
wanna,
it. Thank you.
of course. All
Thank
right,
you.
you guys take care.
Thank you.
Yes,
Appreciate
as
you,
well.
man. Thank you.
Thank you.
You're
Bye-bye.
welcome.